And so let's dive into herbs to support diabetes. Cinnamon is reported to be beneficial in reduction of hemoglobin A1C and reports on reduction of triglycerides, LDL, which is considered to be the bad cholesterol, the low-dense lipoprotein, and total cholesterol in patients with type 2 diabetes, but other studies reported conflicting results. Dosage in studies that is used is anywhere between 500 milligrams to 3 grams per day. Now, typically 1 gram a day and even 500 milligrams a day will produce some results. But again, studies are conflicting, and some of them, it could be just because they use different dosages, they use different time periods, where some herbs need 30 days to start seeing the benefit. Some conditions might need 3 months or 6 months or 12 months of using a certain compound to actually see beneficial results, right? Cinnamon was used in higher dosage with 60 people in a clinical trial with type 2 diabetes. The average age was about 52 years old. They used the cinnamon for 40 days. Dosages were in one group, 1 gram, which is 1,000 milligrams, 3 grams, 6 grams, or placebo, right? The results of the trial, after 40 days, all cinnamon consuming groups reduced the mean fasting serum glucose levels by 18 to 29%, triglycerides levels between 23 to 30%, LDL cholesterol between 7 to 27%, and total cholesterol between 12 to 26%. There were no significant changes in the placebo groups. So what does that tell you? That cinnamon could be a great addition to treating patients that have diabetes, that have a high lipid profile, that have high LDL or triglycerides, right? So it can help support metabolism. In the Chinese medicine perspective, cinnamon is a very warming herb that helps to increase circulation, increase metabolism. Cinnamon, which is used as a spice, you can buy it in capsules, a capsule form, and that's what typically they use in clinical studies. How does cinnamon work? Well, reducing insulin resistance by activating insulin receptors, kinase, and inhibiting dephosphorylation of the insulin receptor. It's also mimicking insulin, which allows glucose to enter the cells and activate glucose synthase, which stores glucose as glycogen. So some of those studies show that cinnamon actually activates the same receptors that insulin does. So it's really interesting to see how that works. And typically, we recommend to consume cinnamon. That would probably be with meals, with diabetic patients or pre-diabetic patients, because we want to make sure that if they don't have enough insulin secretion, we want to make sure that cinnamon will help to stimulate those insulin receptors on their cells and get the glucose into the cells, which is what insulin is supposed to do. Again, careful with patients that are consuming insulin, because both insulin and cinnamon have a very similar effect, right? Another herb is Gymnema Sylvestre, which is also referred to by some practitioners as the sugar destroyer. It's reported to decrease the uptake of glucose from the small intestine, so it reduces absorption of glucose. It improves glucose metabolism, it decreases hemoglobin A1C, and improves the insulin secretion, right? Now, interesting thing about Gymnema, when you put it in your mouth and you kind of suckle on it for a few minutes, it actually neutralizes your taste buds. So you can't taste sugar, you can't taste sweet. So this led some practitioners to believe that to recommend Gymnema to patients typically before meals, about 15 minutes before meals, out of the notion or the idea or the theory that it will prevent sugar craving after meals. And if it's true or not, it's hard to say, but I've never noticed that to be the case. I typically would recommend it to patients with meals or before meals as needed. Powdered leaf, you can get it in a tablet or a capsule form for about 400 milligrams. That's typically will be the dose. Some patients need 400 milligrams or 200 milligrams 2 times a day, and I would typically recommend to slowly increase that into 400 milligrams twice a day, right, with the 2 large meals of the day. Another herb that I want to mention is fenugreek, which is reported to significantly reduce hemoglobin A1C levels and reduced blood glucose levels. This was noted as effective only in really high dosages of about 5 grams per day. So it's really important to mention that because some patients will read about it and start taking it, but it's actually not going to be effective until they reach out to the higher levels of those herb consumption.